Good afternoon. I'm Michelle Williams, Dean of the Faculty here at the Harvard T.H. Chan School of Public Health. And it's my great pleasure to welcome you to When Public Health Means Business, Chasing Science to Save Lives with Dr. Anthony Fauci and moderated by Dr. Sanjay Gupta. Our program today is presented in partnership with the New England Journal of Medicine. Here we are, days away from the close of 2020, and we are at an inflection point. While the news around vaccines are promising, the day-to-day headlines are as grim as they have ever been. An American is dying of COVID-19 every 90 seconds. We've recorded 4 million new COVID-19 cases in November and more than 1 million cases in December, just 9 days into this month. COVID-19 has just passed heart disease as the #1 killer of Americans. And as of this morning, more than 286,000 Americans have died due to COVID-19. In just one day, yesterday, we lost 2,600 of our fellow Americans to COVID-19. To put those numbers into context, we are experiencing a tragedy on the scale of Pearl Harbor every single day, right here at home. And from an economic security standpoint, we are facing the greatest threat to value creation since World War II. If there were ever any doubts about the seriousness of this virus, these facts should cast the doubts aside. Simply put, we have been brought to our knees by an invisible foe. And I have to be honest, I have wondered, have we gone numb to these numbers? All across the country, I see photos, I see film footage of people in malls and at birthday parties, congregating in large numbers without masks and without physical distancing. I think hard about the lives behind the numbers lost, and I wonder if perhaps being numbness is the way we are coping with this epic public health challenge. How could we be acting so recklessly otherwise? At the very same time, I'm astounded by the enormous successes of science. mRNA vaccine genetic technology has brought forward a whole new class of vaccines. And while the development of these vaccines occurred in record time, it took years of research to lay the groundwork for these astonishing breakthroughs to surface. Science was prepared, even if we were not. As a lifelong public health educator, I won't lie to you, I grapple with the facts that so many of us, especially some of our leaders, appear to be so unwilling to follow the science. And I think we must all recognize that this resistance to science, this resistance to evidence, is a clear and present danger to all of us. We've already witnessed how reluctant some people are to wear masks and to socially distance. And we also know that vaccine hesitancy is a challenge that we must confront. According to the November Pew survey, just 60% of Americans said that they would definitely or probably get the COVID-19 vaccine. We also have to remember that while that number is up from 51% in September, it's still down from the 72% who said that they'd get the vaccine back in the survey conducted in May. What is even more troubling is that 20% of Americans say that they are pretty certain that they will never take the vaccine, no matter what new information they learn about it. Think about it. That's 1 in every 5 people who won't take into account the safety of their families, their friends, their neighbors, your and my health. Some of this skepticism is understandable, especially among those who have not historically been well served by our medical and public health institutions. But vaccine hesitancy and skepticism are also what will turn this inflection point into an even greater tragedy. And so it's incumbent on all of us, scientists and the public alike, to work in tandem, with public health playing a central role as the spearheading leadership voice in a vaccination campaign. The race to end this pandemic involves each and every one of us. We cannot work in silos, we must work together. What we do now, our triumphs and our failures, will become the very foundation for how we deal with similar or even worse global public health threats ahead of us. As the COVID-19 vaccine begins to be deployed, I am reminded, quite strangely enough, of something a famous military leader, Napoleon, said to his valet ahead of a battle. He said, "Dress me slowly because I am in a hurry." Saving lives is now a race against the clock. So let each of us slow down, contemplate the role we can each play to protect our loved ones and strangers alike, and do the right thing, because we simply cannot afford to go numb. Let's leverage the tools that science and public health offers us to save lives. Let's do this with a sense of urgency, an urgency as though every life depends on what we do now. Because quite frankly, every life actually does. And so with this introduction, I want to say how grateful I am to Dr. Anthony Fauci and Dr. Sanjay Gupta for helping us continue this important conversation. Sanjay, over to you, my friend.
Dean Williams, thank you very much. I'm so honored to be here, so honored to be with you and obviously Dr. Fauci. And I have to say, we did one of these conversations earlier in the summer, and I think it was one of the highest impact conversations we've had throughout this pandemic. So thank you for inviting us back. I could not agree with you more that science is leading us forward and has done so much in addressing this pandemic. But I've also been reminded lately that we are this quick fix, shortcut sort of society, always hoping for the magic cures and potions instead of leaning sometimes into the simple, effective tools, which may require a little bit more work. Our human spirits made us so innovative and creative and resourceful and tenacious, but it's our human behavior that will dictate, I think, how deep these wounds ultimately will go. As good as the science is, no amount of science, I guess, can rescue us from ourselves. And that is a theme that I'd like to talk about today, and remind people that we are also doing this in an academic environment, this conversation today, one that is training the next generation of public health leaders and is populated by hardworking public health experts, many of whom are watching and are helping us get through this crisis. We are honored to be joined by Dr. Anthony Fauci. He is director of the NIAID. Everyone in the world knows him by now. We're also streaming on CNN.com and showing on CNN in certain markets as well. Please submit your questions to Dr. Fauci at the address theforum@hsph.harvard.edu. Again, that's the forum at hsph.harvard.edu, or in the Facebook comments at Harvard Public Health. But now on to our distinguished guest, Dr. Fauci. Welcome, sir.
Good to be with you, Sanjay. Thank you for having me, and thank you, Dr. Williams. Appreciate it.
I think these conversations are so important. As I mentioned, Dr. Fauci, a variety of topics we'd like to cover. Let me just ask about the news today. You heard about these two people in the UK who received the Pfizer vaccine yesterday. These were two healthcare workers, nurses, I believe, who had significant allergic reactions in response to the vaccine, pretty clearly within moments of having received the vaccine. How concerning is this?
Well, it obviously, Sanjay, is of some concern because there are people who have what's called allergic diatheses, or a tendency to get allergic reactions. I believe that both of those individuals did, in fact, have that tendency. What we need to do looking forward, and these are the kind of things that happen when you implement large vaccine programs. Remember, we had 30,000 people in the Moderna trial and 44,000 people in the Pfizer trial. Once you start implementing the actual utilization of the vaccine in a clinical setting, you're talking about millions of individuals getting vaccinated. So you may start seeing effects in some that might not have been picked up when you were dealing with thousands. So it likely is an unusual and rare effect, but clearly everyone now is aware of that and will be looking at that, and particularly taking care of people who do have underlying allergic phenomena that they might be cautious about vaccination, or at least be prepared to respond with some sort of antidote to the allergic reaction. So if I were a person that had an underlying allergic tendency, I might want to be prepared that I might get a reaction and therefore be ready to treat it.
Right now, the guidance, as you probably know, sir, from the UK, is that people who've had severe allergic reactions to food, to medicines, or to previous vaccines should not take this vaccine.
Right.
That could be a pretty significant percentage of people, Dr. Fauci.
Yeah, it could. It could. And you know, Sanjay, that's one of the reasons why it's important to cover the waterfront with different vaccine platforms. You know, you and I have had that discussion that there are many vaccines throughout the world that are being tested, but we in the United States are supporting, developing, and facilitating the testing of at least 6 candidates. So if in fact we do find out that there is a consistent issue of certain subset of people, like those with allergic reactions, you'll always have other vaccine platforms that you can use, and hopefully you will not see that with those other platforms.
I want to ask about schools as well. We're going to be taking some video questions here in a few minutes, but you know, it's interesting with schools, and I was surprised at how well most schools have done in terms of keeping overall infection rates down. I was skeptical, just thinking that flu viruses transmit easily, respiratory viruses transmit easily, but so far positivity rates in schools pretty much have stayed low. What do you think that means going forward? I know you said keep schools open and keep bars closed. But at the time we decided to shut down schools, there were some 5,000 people who'd been infected. Now there's 15 million people who have been confirmed to be infected. It's obviously spreading, pretty significantly in just about every place in the country. Should schools stay open in the middle of all that?
Yeah, the answer is, Sanjay, what you and I have discussed before, is that our default position, there will always be exceptions. There's never one size fits all. But in general, our default position should be we should try to keep the schools open and get children back to school who are not in school as best as we possibly can. The data that you are seeing and that I'm seeing also is that I agree with you. I was in the same boat as you. When you look at it, the number and percentage of children who are getting infected, even when there is community infection to a certain degree, is less than you would have expected by extrapolating from the general community, which is really good news for keeping the children in school. Now, obviously, if you want to do that, you want to make sure that you take into consideration the safety and the health of the children as well as the teachers. But in general, it looks like we can keep the children in school and get them back to school safely. I believe strongly that as we implement vaccines and we get the level of infection in the community lower than it is now, which, as you know, is very high, it will be even easier to keep the children in school and to protect them.
And what do you say to teachers and faculty members and adults who work in those schools? I've gotten so many emails after the back and forth in New York City schools from teachers who are basically saying, what about us? Are we at greater risk as a result of these schools being open?
Well, apparently not. I mean, obviously, you continue to collect data and you continue to modify, if necessary, your policies based on the data as it comes in. But right now, given the level of infection that we're seeing in children in school, it does not appear that the risk to the teachers is any greater than the risk they would face by being in the community in general.
I want to ask about testing before we talk about vaccines. You and I have talked a lot about testing over the year, and I think you've said, and we've had this conversation a few times, that there has not still been adequate testing in terms of overall numbers in this country. I want to frame the question a little bit differently, Dr. Fauci. For people who don't have symptoms, they're asymptomatic, they just want to get tested to find out if they are in fact positive, what exactly should they be looking for? Because if you have symptoms, you should stay home. If you find virus on one of these PCR tests, it could be active virus, it may not be active virus. If you're just trying to find out whether or not you're contagious, which seems to be the question you're really trying to answer. I have no symptoms. I want to get tested to make sure that I'm not contagious to other people. I don't care if the test comes back positive. I just want to know if I'm contagious. Can we answer that question? Could the average person answer that, what seems to be a fundamental question at this point?
Well, Sanjay, in order to answer that question completely accurately, I think that our listeners and viewers need to understand that there are tests for different purposes. You mentioned one of them. If you've been exposed, either symptomatic or not, and you want to find out if you are infected specifically at this moment in time, then you want the more sensitive, more cumbersome, more expensive PCR test that you can't get in 10 or 15 minutes. It's going to get at best a day and sometimes 2 and 3 days. If you're looking to get a feel for what the penetrance of infection is in a particular group, in a college, in a factory, in a nursing home, even though there is no one there that's having symptoms, you can get a feel for that by doing a less sensitive test more often. Let me explain what I mean. So let's take the antigen test, which isn't as specific or as accurate as the PCR test. If you get tested 2 or 3 times a week, the lack of sensitivity of that test will be made up for by the frequency with which you get it. The other point that I believe you were referring to, Sanjay, is that even though the sensitivity might be lower in the antigen test that's more of a screening test, if you wind up getting a level of virus that is not picked up by the antigen test because it's so low, you could be infected, but your virus is so low that you are not infective. Right. Namely, you're not going to transmit it because it's not picked up by the antigen test. You likely would pick it up by the PCR, but what we call that the cycle threshold would be at such a level that even though you pick up virus, it's not at a level that you're going to transmit. Right. So I think that's something we're learning more and more about. The more information we get, the more confident we'll be as to whether or not these tests can be used on a basis of screening to tell you at least I'm not infective to someone else.
I think this is such a fundamental point because ultimately, how do you make these sorts of tests actionable in people's lives? Somebody that's taught me a lot just from reading his work is Michael Mina, who you know as well, Dr. Fauci. As it turns out, he's joining us right now. He has a testing question.
Testing is one of the most crucial public health tools to fight a pandemic. However, in the US, we view all tests through a single lens, which is for clinical medical diagnostics. This is because we have only a single pathway for evaluation of tests throughout the FDA. But for tackling a public health problem, we need tools tailored for public health. Tests must be accessible, they must be fast, and they must be frequent. Is there a role for a new pathway for evaluation of tests focused squarely on public health metrics, which is distinct from medical diagnostics?
Well, he's asked the question after I gave the answer, which is good. No, his question is totally relevant, Sanjay. And I know I've listened to Dr. Minner make that point about the difference between testing for a medical reason and testing for a public health reason. And that is a very important issue that I think we need to pay much more attention to because it really addresses the question you asked me about not necessarily definitively knowing if this symptomatic person is or is not infected versus from a public health standpoint, what's the level of infection in a college dorm,
Right.
or in a factory, or in a prison, or in a place of employment. That's what Dr. Min is talking about. That's a public health question as opposed to a specific medical question.
Do you think that we would ever get to the point where we would be able to have the type of testing Dr. Mina is talking about? He is describing doing regular at-home testing, antigen testing, again, lower sensitivity, but maybe over, because you're doing so many of them, able to give you information that's actionable in terms of whether you're contagious. I bring this up, Dr. Fauci, not to keep belaboring this point, but we heard the 3 pillars that President-elect Biden talked about yesterday: masks, vaccines, schools. I feel like testing, again, has been inadequate all along and is still very important, especially over the next few months. Could we get to that point where we have, tens of millions, hundreds of millions of tests?
Sanjay, there's absolutely no reason why we cannot get to that point. We have done things infinitely more complicated than that. We have the technology, we can do it. We can get home tests that are point of care, sensitive, specific, cheap, without the necessity for a prescription. That's eminently doable. And when we get there, we can have yet another dimension for being able to control this outbreak by understanding literally in real time what the extent and the penetration of infection is in any given segment of the community.
Let's talk about the vaccines for a minute, and there's several questions that are coming in about this as well. First of all, just to define some terms here, 95% effective or efficacious at preventing COVID-19. That's what we know about it, at preventing the symptoms of this disease known as COVID-19, but not necessarily at preventing infection or transmission.
Right.
Do I have that right? And does that make a difference? Like when you think about the flu shot, for example, does that prevent infection or does it prevent people from getting sick? How is this going to work if it doesn't necessarily prevent infection?
Right. Well, it's very similar to the flu. I mean, you get a flu shot, it can prevent you from getting infected, but as often as not, it prevents you from getting symptomatic, because the efficacy of the flu vaccine is how it prevents you from getting sick enough to require medical care. That's the efficacy of the flu vaccine. So that's something that I think people don't fully appreciate. Very similar. So the primary endpoint of the 2 vaccines in question, the mRNAs from both Pfizer and Moderna, are the prevention of symptomatic disease. The secondary endpoints are the prevention of severe disease and the prevention of infection. So let's take a look. The primary endpoint was met in spades, 94 to 95% effective in preventing you from clinically recognizable disease. With regard to severe disease, the news is in some respects even better. It's close, at least with the Moderna that we've seen the data on, it's close to 100% efficacious in preventing you from getting severe disease. What we don't know right now is the degree to which it prevents you from getting virologically infected. We will find that out as we get further and further on in follow-up of individuals. But today, we don't have the answer to that question. One of the things that is conceivable, Sanjay, is that it will either prevent you from getting infected, or if it doesn't prevent you from getting infected, the immune response that's generated by the vaccine may be sufficient to diminish the titer of virus in your nasopharynx low enough that you are infected, but not infective. Namely, you're infected, but you're not going to be transmitting it to somebody else. We don't know now the answer to that question, but we're going to find out from follow-up studies.
So to be clear, until we find that out, if you have been vaccinated, and again, that may happen for people even over the next few weeks, if you've been vaccinated, you probably still need to wear a mask. Am I right? Because you could still be carrying the virus, potentially transmitting it, even if you're less likely to get sick yourself.
Absolutely. There's no doubt. We should not say that vaccines are a substitution for public health measures. It's a complement to public health measures. Protecting yourself from clinical disease, protecting yourself from severe disease, possibly protecting you from infection. But if you still have virus in your nasopharynx, you want to wear a mask, even though you know you're not getting sick from infecting someone else. And since the vaccine is not 100% effective, and we don't know what the durability of the protection is, you also want to wear a mask to protect yourself from getting infected. So wearing a mask, physical distancing, avoiding crowds, that should all stay as we get into the vaccine program, because there's still a lot of virus out there.
And so, just following up on that, for how long do you think that we continue then with those basic public health measures of masking in public? Again, taking everything we've now discussed into account, how the vaccine works, what the endpoints are, what it's likely to do for the individual. What does that then mean for society as a whole?
Well, there's one parameter in there that you have to factor in if I'm going to accurately answer your question. And that is, what percentage of people in our society are going to be willing to be vaccinated? Because if we have a 95% effective vaccine and only 40 to 50% of the people in society get vaccinated, it's going to take quite a while, Sanjay, to get to that blanket of herd immunity that's going to protect us enough so that you and I would feel comfortable in going out into society and saying the level of virus is so low, it's not a threat to anyone. Let's say we get 75%, 80% of the population vaccinated. If we do that, I believe if we do it efficiently enough over the second quarter of 2021, by the time we get to the end of the summer, i.e. the third quarter, we may actually have enough herd immunity protecting our society that as we get to the end of 2021, we could approach very much some degree of normality that is close to where we were before.
You've seen the trial results from the Pfizer data so far. One of the things that jumped out at me was we hear about the 95% or so after 2 doses. But after the first dose, there was also a fair amount of protection. It was 52.4% roughly, obviously a lot lower, but better than the 50% that the FDA originally required. Does it make sense to you to take the 40 million projected doses by the end of the year and give all those as first doses to people? So you vaccinate more people, at least with some vaccine, manufacture the second dose for them in the following weeks or months.
We considered that, Sanjay, and we decided that it would be more prudent not to do that, namely to get the real total degree of protection, not the 52%, but the 95% after the second dose, because you're going to start getting that kind of immunity anywhere from 7 to 10 days following the second dose. So even though theoretically you can make an argument for that, the fact is if we have enough doses, which we anticipate we will, then we would like to get everyone vaccinated fully as quickly as possible.
You and I've had so many conversations about these topics over time. We've talked obviously here and on CNN and things like that. I was reading this piece, the Day on the Life piece about you in the HuffPost, and you talk about the fact that you spend time really trying to get these public health messages out in these types of forums. But I wonder, have you considered talking to platforms such as OAN, Newsmax, Parler, things like that? Audiences that maybe not hearing you in these types of forums, but definitely need to hear the message?
Yeah, the answer is yes. Sanjay, I'm willing to talk to anyone in any platform that we can effectively get the message across, particularly in the arena of the importance of people getting vaccinated, because we don't want that to be the missing link in our success, is not having people getting vaccinated. So, sign me up.
How do you balance though between being a cheerleader for these public health practices, providing the evidence, the science behind them, and also being this sober-minded scientist? I mean, you there's too many people who still are not abiding by these basic public health measures. 10, 11 months into this. I mean, we've had so many conversations. At what point do you sort of change the message a bit around masks or physical distancing? People who do it have heard the message and they're doing it. People who are not doing it have also heard the message and they're not doing it. So what do you do in your position?
You know, as you well know, there's that famous saying that Albert Einstein said, that the definition of insanity is doing the same thing over and over again and expecting a different result. I don't think we're insane for continuing to try and convince people. I just think that perhaps we have got to get community people that we engage with to give a message coming from individuals that are more trusted by the community. Now, sometimes the recalcitrant people, Sanjay, need to hear it from a leader that they respect. And maybe that's not necessarily the public health officials, but maybe some of the political leaders that they respect. That's a possibility that could help. I will not and should not abandon the scientific basis of the messages that I give because there are some people who are not listening to it. I think you always have to have the evidence-based and the science-based fundamental platform for where you make your policy. It is frustrating that there are some people that no matter how often you say it, they just don't believe it. We have people in certain parts of the country, Sanjay, that you are well aware of, in which the hospitals are in the danger of being overrun, either with lack of staff or lack of beds. And in that region, people still believe that this is fake news, that it's a hoax. It's incomprehensible to me, but it's true. I have to admit, Sanjay, I don't have an easy answer how to access those people. I don't. It's not easy. I could stand on my head. I don't know it's going to make any difference. I'm not so sure we're going to reach those people.
I'm curious how frustrating that is for you. And I don't want to make this overly personal, but I know it's been a very long year for you. I will say it feels like there's a lightness about you now, a little bit of a pressure off your shoulders, maybe, I don't know. But how do you deal with what you just described? You've been preaching this for so long. Have you thrown up your hands? Are you in frustration? I mean, how do you get through the day?
Sanjay, I would never do that. I think the enormity of the problem and the responsibility that I have as the director of the Infectious Disease Institute, whose responsibility is the science leading to the advances which actually have put us in a good position regarding vaccines and therapies, but also as a public health official, that I have a responsibility that it is not an option to throw your hands up and get discouraged and walk away from it, because the enormity of the problem and the suffering and the morbidity and the mortality is such that it would be unconscionable to walk away from this or to throw up your hands in frustration. It's not about me and how I feel. It's about what the problem is. And the problem is enormous. So that's the reason why I say, I don't want to get too graphic about it, but you just got to suck it up and keep going, no matter how frustrating it gets.
When I hear Dean Williams talking about a Pearl Harbor every day, a 9/11, every day or so, I often sort of grapple with this idea of how much do you really expose the audience to? I mean, most people haven't really seen the actual suffering that accompanies COVID-19. They haven't, unless they've been in the hospital, which I have and you have. They probably haven't seen what that really looks like. And I wonder, when you're talking to your colleagues, your friends or your family, you're trying to describe the actual suffering that goes on with this disease. 286,000 Americans have died from it. How do you describe that level of suffering?
The trouble is, Sanjay, when you get to numbers that are so numbing, over 280,000 deaths, 14 to 15 million infections, that it almost becomes, a meaningless cold statistic to people unless they can make the connection between suffering human beings and those enormous numbers. Not everybody is going to be in that position. I mean, today, literally today, a few hours ago, I was across the lawn from the room I'm in now over at the NIH Clinical Center, making rounds on our patients, a couple of whom had COVID-19. And when you see a real patient in the room and you see the MRI and the CT scan, and you look at the pulmonary functions and the oxygen saturation, all of a sudden it becomes really real. And then that one person or two people that we saw on rounds today, multiplied to the 280 plus thousand people who died, it's the enormity of the problem. It just can actually overwhelm you. You don't want to overwhelm the general public, but you want them to at least understand that you're dealing with real suffering and real disease and real loss in the form of death of loved ones. That's where we are right now. We can't walk away from that problem. And it would seem to me that that has to be motivation enough for at least most of the people to adhere to the public health issues and the public health recommendations that we make, as well as to seriously consider utilizing a highly efficacious vaccine.
Have you had any personal sort of friends or family members who have dealt with COVID-19?
You know, the answer is yes, a few, but one in particular, my youngest daughter's boyfriend's brother is a 32-year-old young man, athletic, healthy, who got COVID-19 and had one of the unusual complications of cardiomyopathy with an arrhythmia and died. So there you have a 32-year-old young man, otherwise healthy, actually, quite athletic and strong, who died. Very sad. It was very much made of really saddened my daughter greatly.
I'm really sorry, Dr. Fauci. I don't know if you shared that before, but I'm sorry to hear that. You do hear these stories of young people getting very sick and dying, and it's one of these things. We talked about this, I think, back in March or April. At that point, you said we really have no idea why some people, most people, frankly, do well, recover, but some people just don't. Do we have better insights now, even among younger people, why some people are getting so sick and others seem to be, dramatically less affected by this?
You know, the answer to that question, Sanjay, sadly, is that we don't know. I mean, the obvious thing is that someone has underlying medical conditions that don't allow their immune response to respond adequately. But the mystery, and I've told you this before, that haunts me, actually, because I'm someone who studied the pathogenesis of viral diseases for my entire multi-decade career. The idea that you have a virus that in most people is almost harmless. They don't even get any symptoms. And then in those who get symptoms, most people don't get severe symptoms. And then in another subgroup, inexplicably makes them so sick that you get 280,000 deaths in the United States. I don't know the answer to that question, Sanjay, and I'm sorry to say, I just don't. I hope we someday find out.
I do too. I was just reading a story earlier about these twins, 60-year-old men, both contracted the disease around the same time. They both recovered ultimately, but one had a much rockier hospitalization course, and they're twins, genetically identical. So I hope we get the answer to that. We have lots of questions coming in, Dr. Fauci. Questions about the vaccine, specifically about how successful we will be at vaccinating everyone, especially the people who need it. Here's a question from Mayor Keisha Lance Bottoms.
Hi, Dr. Fauci. I'm Atlanta Mayor Keisha Lance Bottoms. We've seen the racial ethnic disparities as it relates to COVID-19. In Atlanta alone, Nearly 40% of our cases are attributable to the African American community, yet 85% of deaths are in the African American community. My question is, how do we better work with the federal government to help address the racial and ethnic disparities that are making COVID-19 more deadly in communities of color?
Well, I believe, Madam Mayor, that it's a two-step process, one that's immediate and can address the situation as it exists now, and one, I believe, has to take the form of a long-term commitment on the part of our society. The immediate issue is to have available the testing capabilities and the medical care accessibility to the African American population as best as we possibly can under these somewhat emergency circumstances. Because clearly, African Americans, on the basis of the jobs that they have to a greater degree than others, of putting them out in the community in a situation of exposure with generally essential jobs that give them a greater likelihood of actually getting infected. Once they do get infected, the incidence and prevalence of the underlying comorbidities that they have put them at a much greater danger of a severe consequence of COVID-19 disease. There's no doubt about that. They have 4 times greater chance of getting hospitalized and at least twice as great a chance of dying. The thing we need to do is to try and get them the access to the care that they need by putting resources in those areas that demographically are overrepresented by minority populations, African Americans, and to some extent, Latinx. But to me, what I see, having been through a number of outbreaks of different diseases that disproportionately afflict minority, particularly African American population, is to address now the decades-long problems of the social determinants of health, which allow an African American man or woman who have a higher degree of diabetes, obesity, hypertension, liver disease, kidney disease. Those are the things that lead to the consequences of COVID-19 that are very severe. As you know better than I, Madam Mayor, those things begin almost at birth for the circumstances in which our minority populations grow up in, the diets that they're exposed to, the economic conditions. We, if we want to have some commitment that we can say never again, if we want to get out of this, which we will, where are we going to go in the next few decades to overcome the health disparities which allow for those extraordinarily depressing numbers of minorities suffering disproportionately from this disease? It's a long-range commitment. We shouldn't forget it.
Let's stay on that theme for a second, Dr. Fauci. Cornell Brooks, he's a professor at the Harvard Kennedy School, also former president of the NAACP, has a question, I think a powerful and important one.
Dr. Fauci, thank you for your service to this country. And my question is quite simply this. With over 2 million people behind bars in America's prisons and more behind bars in America's jails and juvenile lockups, would you and how might you prioritize the distribution of a vaccine to those behind bars all across America and out of the eyesight of many Americans?
Well, that's a great question. That certainly any answer is going to be controversial, because if you say prioritize, then someone will say, well, then you're taking it away from someone who never committed a crime and is out there and needs the vaccine. Putting that aside, I would say that we should prioritize vaccines for the most vulnerable. And it appears to me that you can make a good case that people who are in situations, be they in nursing homes or prisons or other places where the likelihood of getting infected is very high, that we should at least seriously consider adapting our countermeasure approach to the degree of danger and risk that people are in. I don't make policy, sir, for what's going to happen in prisons, but I think you could make a good case that you're dealing with a vulnerable population that have little capability of getting themselves out of that vulnerable situation. So somehow or other, we've got to come and give them some help. And help may be in the form of vaccines.
Should these types of policies, Dr. Fauci, be made at the national level? I know you don't make the policy, but should there be a uniform policy across the country? Or because right now it seems like each state is sort of determining their triage and distribution of the vaccines. Questions like the one Professor Brooks is asking will be decided at the state level. Does that make sense to you?
Well, the positive aspect, Sanjay, of making things at the state level, as you know, I'm saying things that you are very well aware of, is that each state may be a little bit different in different ways, that you want to be able to give them the flexibility of adapting a policy to their particular situation. But there are some things that are common denominators that apply across the board that deserve a certain action. And if you leave it up to the states, if the state, one state or another, may decide they don't want to do it, that may be really unfair to the people in that state, because there are things that are common across all states. And you could have a recalcitrant state that just doesn't want to do it, and the people in that particular environment would suffer more than people in comparable states that are doing it. It's under those circumstances that you call for a central type of decision.
We were talking earlier, Dr. Fauci, and again, I really appreciate these sorts of conversations. I remember in the past, I've known you for so long, in the past, going back to like anthrax even and other outbreaks, we used to see you all the time, out front, really educating the country, helping people understand what was happening. In the next couple of months after the new administration is sworn in, will you be returning to that sort of role as chief medical advisor? Are we going to see a lot more of you from a lectern, educating people, maybe even on a daily or a regular basis?
I can't say for sure, but I believe so, Sanjay. I have been told by the transition group, by the leaders of the transition, that, as you said, that the president-elect wants me as a chief medical advisor. And in that capacity, I cannot imagine that it will not include being out there in the public, giving the kinds of messages that I have in the past. I would certainly expect that that would be the case. I would be surprised if it were not the case.
Actress Octavia Spencer, I'm sure you know her, Dr. Fauci. She has a question for you along these lines.
Hi, Dr. Fauci. My name is Octavia Spencer. And first of all, I'd like to thank you for all that you're doing to keep this country safe. And I'd also like to say I think Brad Pitt did a wonderful job playing you. My question is, what trusted sources should we rely on regarding the vaccine safety, and how do we amplify these voices?
I'm going to say something, Ms. Spencer, that is the truth, and I hope people believe this. The career scientists at our Food and Drug Administration, our regulatory authorities, are totally committed to the safety and the health of the American public. So when a vaccine is deemed to be safe and effective by the FDA, the American public needs to appreciate that that process of that decision was both independent of the administration, independent of the drug companies. It was independent because the data were looked at by an independent data and safety monitoring board, analyzed by career scientists, and the decision made in accordance with an advisory group that is also independent. You put all those things together. If the United States Food and Drug Administration says that a vaccine is safe and effective, I can promise you that I will take that vaccine myself, and I will recommend that my family does that. So I think the authority should be the United States Food and Drug Administration.
You've talked a lot about equity when it comes to these vaccines, Dr. Fauci, and I want to throw a question to you from the board chair of Gavi, the Vaccine Alliance, Ngozi Okonjo-Iweala, has a question specifically about the distribution of these vaccines. And I'll preface by saying something that you told me a long time ago. an outbreak anywhere in the world is an outbreak everywhere in the world. And we have to remember that. But take a listen to this question, sir.
Dr. Fauci, what are your views about the international equivalent of Operation Warp Speed, known as the ACT Accelerator, and its offshoot, the COVAX facility? This is designed to assure affordable and equitable access to poor countries for vaccines, therapeutics, and diagnostics. Will the United States join the effort? What are your views about vaccine nationalism in the context of this pandemic?
Well, that's a great question. I can firmly answer the second question. I don't think I can give you a firm answer in the first question, and that is I cannot speak for the United States as a whole and what we do with COVAX and what we do with the international availability of vaccines. I can tell you my own position, and that has not changed over many decades. It originated in my position as a health authority and a scientist during and continuing to today with HIV/AIDS and the United States PEPFAR program and the United States contribution to the Global Fund, that I feel that since, as Sanjay said, a global problem is a global problem. That means everywhere on the globe. And there are countries on our globe that have different resources and different capabilities of responding to epidemics and pandemics that are common to all of us. So I feel as an individual, and I can't speak for my country as it were, but I can tell you how I feel, that we have a moral responsibility as a rich country, along with other rich countries, to make sure that when we have the facilities and the capabilities, be it life-saving drugs for HIV, life-saving preventions for HIV, or a vaccine for COVID-19, that as a global community, we do everything we can to make sure that there is the equitable distribution of those countermeasures throughout the world, so that there are not countries, because of their economic status or other aspects of their status, that they don't have the capability of vaccinating their citizens. I think we all need to pull together as a global community to make sure there's equitable distribution.
You know, we talk a lot in this conversation about the role of government, the role of personal responsibility. I'm curious, I get a lot of friends of mine from the private sector who talk about ways that they might be able to help. And we have a question along those lines from Arno Bernardi. He's head of Shaping the Future of Health and Healthcare at the World Economic Forum. Take a listen.
Dear Dr. Fauci, under your leadership and thanks to your relentless effort, NIH has significantly contributed to getting multiple vaccines to the world. We do thank you for that. As the World Economic Forum head of health and healthcare, I'm yet a little concerned that I see a drop in vaccination intentions over the past 3 months. My question is the following. Do you see a role for employers to play in the education of their employees on the benefits of vaccinations? Thank you very much.
Thank you for that question. And the answer is absolutely yes. In fact, one of the best ways to get to people is through their place of employment. And employers, particularly of large organizations that can influence large numbers of people, have a unique opportunity to do really good things by educating their employees, for example, on the benefits of vaccination, and even maybe being the focal point of how the vaccines are distributed. And we have seen that in the past, where employers have served, whatever that may be, a large organization, a large institution, a large factory, as a place for the delivery of certain healthcare commodities, be they vaccines, be they testing, be they distribution of drugs. We've seen that. It does work.
Dr. Fauci, one thing a lot of people ask about this vaccine is obviously the durability, something you've talked about. Is there any correlation between the strength, efficacy that we've seen so far in terms of preventing COVID-19 and the durability? Is it more likely to last longer if it appears to work this well?
Not necessarily, Sanjay. I think those are two separate issues. Because if you have a high degree of, let's say, a neutralizing antibody or a good, powerful T cell response that will give you the 95% efficacy, the fact is we have no idea how long that lasts. That could be very potent for 5, 6 months, a year, and then drop off dramatically. The determination of the durability of the response is just going to be a matter of time. We're going to have to see how far out, a year or two. Most of these trials go out for 2 years of follow-up. We'll know the answer to that question in a year or two.
Take one more question before we let you go, sir. This one comes from the former Secretary of Health, Donna Shalala.
Hi, Tony. What has surprised you about this pandemic? What did you learn that you didn't know before?
Well, I learned something, Donna, that is actually very disturbing, is I've never seen a virus like this that has the capability of having 40 to 50% of people don't get any symptoms. They're the ones that are responsible in large part for the silent community spread. A substantial proportion of the people who get symptoms have mild symptoms, and yet that same virus has the capability of devastating other people, putting them in the hospital and killing them. Hence, the 280 plus thousand deaths that we've experienced thus far in this historic outbreak like nothing we've ever seen. That really surprised me, Donna. I did not realize or think that we were going to get a virus in which most of the people do fine, that are going to have such a high death toll as over 250,000 people thus far and still counting. That is very disturbing and in many respects, very puzzling.
Dr. Fauci, I know you have a very important call you have to go attend. I'm not sure if you can share any details about that. We won't put you on the spot. Instead, let me just thank you for your time. And you know, these are such important discussions because we get it not only at some of the specifics, but also your way of thinking, which I think is critical. So with that, we're going to end this amazing discussion. Thank you to Dr. Fauci, Dean Williams, all the experts who shared their questions today as well. Thanks to the audience. We still got a lot of questions coming in. And thank you as well to the Harvard T.H. Chan School of Public Health and the New England Journal of Medicine. Stay well, everybody. Be healthy and be kind.